So, good morning to you. Before we start with anything, I would like to know your name and it's been how many years you are practicing and where are you practicing at?
I am Dr. Kamlesh Patel and I am practicing since last 30 years and at Ahmedabad.
Nice meeting you. So, we're going to be talking about prostate cancer. Firstly, I would like to ask, what are the early signs of prostate cancer?
There are no signs and symptoms of prostate cancer. For that, you must have to evaluate on a regular checkup with the PSA, prostatic specific antigen. If you get it done the checkup after the 50 years, I think everyone has to check his PSA after the age of 50 once, then 55. And if the PSA level is more than 2.5, then yearly evaluation is required after the age of 55 for early detection of the prostate cancer.
Okay, heading towards the next one. What precautions should a man take to minimize the risk of prostate cancer?
That is a real difficult question. The reason is that any cause till date it is unknown. People say that if you improve the lifestyle, if you do a regular exercise, if you are taking a low fatty food, no junk food, and regular life, then the chances of prostate cancer is reduced. But the reality is that it is basically the etiological unknown reason. Familial history is there. If the family is having father or nana or grandfather is having a prostate cancer, then that man should likely to develop prostate cancer in his life than a non-cancerous family history.
Heading towards the next one. So, who in today's date is at highest risk for BPH and also prostate cancer?
Pardon?
Who in today's date is at highest risk for prostate cancer?
See, as though who have family history, particularly in India. While if we are talking about the world, then black Caucasian people in USA, then white racial people in USA, United States have a higher incidence of the prostate cancer in comparison to the Asian male. Another theory is, particularly I feel, is that it is not a higher percentage they have, but no doubt they have a high facility to detect early. They have a higher educated people, and though who used to do a PSA level gradually, checking up there for prostate. So even though there are 5 to 10% of higher ratio, we would feel come on the data, it is more than a 50%. The reason is in our developing country, all the developing country, there is a no protocol has been followed and there is a no perfect data collection which may leads to that incidence shows a very decrease in comparison to the Western world.
All right, lastly, any message for all the upcoming urologists?
For the upcoming urologist, I think people nowadays thinking about the laparoscopy and robotic more and more, but you should not forget the endourology. If you know endourology better, then definitely you are able to perform a good laparoscopy and robotic surgery in comparison to the rest of the urologist. If you are not good in endourology and open surgery, you are definitely not good in laparoscopy and robotic. That's what my personal opinion.
Well, that's all. Thank you very much for your time.